An pilot cocktail party of viruses has stored the lifetime of an adolescent who had a fatal and outwardly incurable contagion. Isabelle's flesh was creature attack by bacteria, and she was taking into account less than rather than a 1% opportunity of surviving. But doctors at Large Ormond Road Clinic taken an unchecked bacteriophage treatment that uses viruses to contaminate and murder bacteria. Isabelle is now training to driving and student for her LA levels. Expert told the instance was tremendously breathtaking and showed the capacity for treat some hazardous infections in bacteriophage. They are the microbe incarnation of the proverb, my foe's foe is my boyfriend. Phages, as well named as bacteriophages, are a kind of natural happening viral infection how infects bacteria quite rather than the flesh's own cells. Looking love ominous aliens, they earth on the shallow of a bacterial and squirt their own gene coding. The hijacks the bacterium cage, lay that in a bacteriophage plant before the viruses ultimately break out of the cage. Isabelle Carnell Holdaway was unborn in vesicle fibrosis. It causes adhesive slime to evolve within her lungs, that can harbor hazardous infections. A family member of Thysis, Mycobacterium abscessus, contaminated her flesh and she necessary powerful antibiotics to hold it in verify. While she was 16, she necessary a dual lung replant, but the bacteria were yet concealment in her flesh. While she begun immunodepressant drugs to hinder her rejection the replant, the contagion came behind. Her physician, Helen Spencer, told, to patients in degrowth of Mycobacterium following replant, in our expertise, all include lost on and dead to several patients, housed during a year in spite violent treat. Isabelle had large, dark, suppurative abnormal changes shaping on her leather wherever the contagion was take conduct. And she ended up in intense thoroughness while her liver disease begun lack, in big colonies of bacteria shaping in her flesh. Doctors told down there was anything they could do, and how Isabelle had a less than rather than 1% opportunity of surviving. Her parents solved to get her household wherever she would be enclosed by household. The concept for trying bacteriophage treatment came of Isabelle's mom, Jo, who had been investigation alternatives on the web. The crew at Large Ormond Road contacted Professor Graham Hatfull, at the Howard Hughes Care Institution, in the U.S., who had the planet's greatest gallery of phages. He had on 15,000 vials of bacteriophage, but it took months to job out that conjunction of phages might job versus Isabelle's contagion. The U.S. crew populated on 3 phages, 2 of that they genetically updated to do them more than efficient. Isabelle's mother, Jo, noted the distinction during weeks. She is in no question her child's lifetime was stored by the viruses. Isabelle's abnormal changes begun to heal up and several wounds how had been outdoor for months begun to shut. It was completely unbelievable the impact the bacteriophage had on her. She's got behind her own lifetime, the lifetime of a 17-year-old lady. Isabelle went behind to high school in September, gone her GCSE maths and is now student for her LA levels. She's as well training to driving. Isabelle's deadly contagion has not been fully healed, but it is by monitoring. She is yet possessing 2 infusions of the virus cocktail party each date. And the household are wait for a 4 bacteriophage to be added to the mix in and try to precise her of the contagion fully. Isabelle's history is wonderful, but as well just a solitary instance. Formally, scientists cannot be specific how efficient the bacteriophage is out of performance clinic testing. Dr. Spencer added, we include to be very careful on extrapolating a solitary person instance to some patients and which it might indicate for them, yet I believe it does promote next study in bacteriophage treatment for several of those persistent bacteria how we're very proper worried on. No, several doctors include been with phages for almost a age. The box advanced in Georgia and some countries in the ex-USSR, but never became main medical. Bacteriophage therapy was eclipsed by the opening of antibiotics, that are lot facilitating to utilize. One antibiotic drug can job through a wide band of bacterium infections, time bacteriophage therapy requires conclusion the accurate phages how will assault every contagion. But now bacteriophage therapy is possessing a revival due to the growth of superbugs how are persistent to antibiotics. The is the big issue and at the time down there is no precise reply. Professor Graham Hatfull, of the Howard Hughes Care Institution, told, "We're kind of in unexplored area. This concept is to use bacteriophages as antibiotics, as thing we could use to murder bacteria how reason contagion. But to use bacteriophage more than wide would need cautious overlapping of phages to a patient's contagion." It shows how bacteriophages can be effectively advanced as therapy though in really hard occasion wherever bacteria are persistent to lot antibiotics and the bacteria are hard to consider. I believe it will cover the way for some such a teaching and assist in receive the required testing transferred out on bacteriophages so how they can be utilized more than wide to consider humans.